Hello, everybody. So we've been anxiously awaiting word from the Texas courts on the OFA versus the FDA case, and we're going to walk through what happened today. Preview, not much, but let me walk you through it. So hello, I'm Christopher Durham, and welcome back to the Downsized. For those of you new to our channel, Laraine and I share our GLP-1 weight loss, treating our disease of obesity stories, talk about the medications, including the challenges, the successes, and everything in between. Before we begin, I want to remind everyone that I am not a doctor. What we share is based on our own experiences and the information we've gathered. Please always consult with your healthcare provider or legal professional for guidance specific to your situation. And because we're talking about court cases, I also like to say I'm not an attorney. So, take it for a grain of salt. But this one's pretty simple today. So also don't forget to hit that like button, subscribe to our channel, and turn on notifications so you never miss an update. Sharing helps us grow this community and get important information to more people. And as 89 of you see out there that have hopped on, it also alerts you every time we go live. So if we're doing something like this, you know about it first. Now, let me share why this matters to me. Well, it's very personal. Since starting GLP-1 medications in September of 2023, I've lost more than 90 pounds. And it's completely changed my life. It's completely changed Laraine's life. We've collectively lost over 140 pounds and I've taken compounded Tirzepatide, Mounjaro, and Zepbound. All three have worked identically for me. Laraine has basically done her entire journey on compounded Tirzepatide with a couple of pins of Zepbound through the way on vacations. As I said, today we're going to discuss the latest developments in the Outsourcing Facilities Association versus the FDA legal battle, a case that could significantly impact access to GLP-1 treatments. This is being heard in the United States District Court for the Northern District of Texas in Fort Worth, with Judge Mark Pittman presiding. So the key updates from the hearing. As we expected, there were no big announcements or decisions today. Instead, we learned more about the next steps in the case, though even those remain a little vague. So more updates will definitely be coming as this unfolds, but no, compounding Tirzepatide was not stopped today. Do not panic. That did not happen. So let's talk about what actually did happen. So as of now, it looks like the enforcement window that the FDA put in place for February and March, those 60 and 90-day windows, are still in effect, but this could move as the case moves forward. It could very well change. It's something we'll need to watch closely. So let's walk through the FDA's decision memorandum timeline. The FDA has committed to releasing their decision memorandum titled Resolution of Tirzepatide Injection Product Shortage and Supply Status within 3 weeks. Now, what is that memorandum? Well, that memorandum is the document they created when they evaluated the Tirzepatide shortage. So basically what had happened was the OFA, after the FDA announced that Tirzepatide was no longer in shortage, the OFA came back and said, well, wait a minute, how did you do this? Where did you get the information? The FDA, they put it on pause for a little while. The FDA came back and said, well, yeah, we actually did. We talked to Eli Lilly, we talked to you guys, we talked to this, and nobody really believed them. And the OFA came back and said, we're going to refile the case. So the resolution of Tirzepatide injection product shortage and supply status will be released within 3 weeks. Remains to be seen what we, the public, will see. The document will outline their stance on the Tirzepatide shortage and compounded medications, which could be pivotal for patients who depend on these treatments. So more to come in 3 weeks on that. So here's what's next in the case. Number one, there will be a motion for a preliminary injunction where plaintiffs will file this motion 2 weeks after receiving the FDA's decision memorandum. So we're starting out a timeline, right? So in 3 weeks, we'll get 3 weeks or sooner, you assume, we will get that document from the FDA. Then within 2 weeks of that, the plaintiffs, which is the OFA, will have to file a motion. Basically, they will file this motion 2 weeks after receiving the FDA's decision memorandum. If granted, this motion could allow compounded Tirzepatide to remain available while the case continues. So they would ask for an injunction, basically a pause. The next step would be the defendant's response. The defendant is the FDA. The FDA and other defendants, who Eli Lilly has since joined the case, if you recall all the movings around of this saga. The defendants will then have 3 weeks to respond. I would assume Eli Lilly will not wait 3 weeks. They don't want to drag this out any longer than they need to, because the longer they drag it out, the longer compounded tirzepatide is available. So potentially 3 weeks. So you've got 3 weeks, 2 weeks, 3 weeks. I would assume it all comes a little bit shorter. And then you'd have the plaintiffs reply. The plaintiffs will then have 1 week to reply to the response. This timeline will determine whether compounded tirzepatide remains an option for patients during the litigation. So as of right now, the only dates we know are the ones the FDA said prior to this. There's February dates and the March dates. So today, everything's still available until those dates, and then we will know more based off what comes out of this set of timelines. It could be as early as 3 or 4 weeks. It could be as late as 7 or 8 weeks, depending on when they turn these things in. There will then be potentially an expedited summary judgment. So after resolving the preliminary injunction, the court plans to move quickly to a summary judgment, and the judge had signaled this prior to this, which will determine the legality of the FDA's actions. The FDA has 3 weeks to compile the administrative record for the court to review. So it's important to note that the court does not plan on deciding whether or not tirzepatide is in shortage. What they plan on deciding is whether or not the FDA acted within their bounds. So did the FDA use their proper guidance? Did they go out and do the research? Did they do everything they were supposed to figure out whether it was actually in shortage? And did they follow the regulations that the government requires? So what this means for us, well, here's the takeaway. Well, right now, no major changes were announced today, but the enforcement windows for February and March remain intact. As the case progresses, those dates and the enforcement measures could change. So this case, of course, is pivotal for patients who rely on GLP-1s. It's not just about compounded tirzepatide. It's about whether the FDA is holding itself accountable and ensuring patients have access to these medications, and about Eli Lilly would certainly say about defending their patents and making sure that there's patient safety. Now, as I've told you, we've taken compounded tirzepatide, not had a problem with it. We firmly believe that state-regulated pharmacies are doing a great job. For Laraine and I, the medications like Mounjaro and Zepbound have been life-changing, but their cost and availability issues mean that compounded options are essential for many others. And we've taken them. I mean, we've paid out of pocket for everything we've taken. So we're right there with you guys. The decision made in this case could redefine how the FDA handles compounded medications and potentially change how access is handled. As you know, we'll continue to monitor the case closely and bring you updates as we get them. This is an important moment for all of us in our GLP-1 adventure, and we want to make sure you have the information you need. So today, I would get your order in. I would make sure you stock up and know things are moving forward at a slow pace. No big surprise. Our legal system doesn't move very quickly. So, the other piece that happened in this was the OFA still has not been able to see all of Eli Lilly's documentation. And Eli Lilly came back and said, there's confidentiality agreements. There's all these things going on, so that they have to come back with a plan on what they're going to redact. So obviously you're a major company. You don't want to give out all your trade secrets. Obviously the OFA wants to know all the trade secrets. Eli Lilly says, no, wait a second. You can't do that. Eli Lilly also protested having one of the OFA attorneys added to the case, because the OFA attorney is not a standalone attorney, a separate attorney. They're also the attorney of record, and they are theoretically employed by the OFA. So there's a lot more legal wranglings going on. But rest assured, Eli Lilly is not going to take this lightly. So not much happened, honestly. But we're back with an update. We're telling you it's okay for right now, and we'll see what happens next. I have Laraine over here. You want to see Laraine?
All right, I'm rolling in.
She's rolling in. She got a new fresh haircut. Say hello, everybody, to Laraine.
Like the weekend update.
So let's see who we have on here today. Hello, everybody. If you've got any questions, I don't know that there's a lot to ask questions about, but let's see who we have here. Melissa Morgan from Montreal, Quebec. You're all good in Canada. Hello from Texas. Deb Zimmerman, who's a member, says hello all. And Simply Taisha says hello as well. Hello, Taisha. I think Taisha's going to come on the cruise with us. That's so Raina. Hi, everyone. Here for the update. Hello, everybody. Jimmy Gerardo, nothing happened. That is exactly the update, Jimmy.
The update is...
Well, I wouldn't say nothing happened. The update is we have a timeline.
They had their hearing. So, I mean, things are moving along, but nothing... There's no action that's being taken from this point. So,
So Johnny says, according to on the pen, OFA has the right to see Lilly documentation, correct? Yes, no, maybe is the answer to that.
I think they're asking.
So yes, the plaintiff and the defendant have to share legal findings, and they have to share these things. Eli Lilly came back and said, and there was a whole other court filing that's basically Eli Lilly saying we want to defend our trade secrets. Court said, well, yeah, I kind of understand. And if I were them, I would want to too. So there's going to be some mediation that will happen between the two of them, and they'll come back to decide what can be shared and what can't. And then the court said, even if we share this with you, you can't share it with anybody else. Not a surprise, right?
And do we even care what the Eli Lilly documents say? Like, does it mean anything to me, compounded tirzepatide user in North Carolina?
Well, the case is bigger than you compounded tirzepatide.
No, I know, but I want to know how it affects me. I'm sure people out there watching want to know how it affects them and their access to compounded tirzepatide. So you guys out there know, if you've been watching, you guys know that we use Mochi Health. Mochi Health is my online provider, and they are still selling compounded tirzepatide. Right now they have a 3-month membership you can do. You can get a 3-month dose. So put your orders in while you can. It's my advice.
Simply Taisha says she loves your hair.
Oh, thank you.
And so does Dion. Hello, Dion.
Thank you, guys.
Oh yeah, everybody loves the new haircut.
I can't do it like this when I'm doing it. I don't know why. I don't know. I guess all those years of doing it the same way. And then the lady that does my hair is like young enough to be my daughter. So I guess this is a more updated do. I'll try to replicate it.
Simply Taisha says her cabin is booked on that cruise. So absolutely. Lots of people loving the hair. We like that. Hello, everybody. Suzanne Saunders says she got 3 extra vials. Phew, yeah, you'll be good for a little while, Suzanne.
Yeah, so I got a 3-month supply, like 2 weeks ago, whenever they came out with it. And it came, and the bud dates were July 12th. So it was a good 6-month window. I got all 3 at one time. All 3 vials were the same dose. People have asked me if you can order different levels of dose. I don't think so. That's something you could call and ask them, but I don't think so. Maybe your doctor could write a prescription in that way, but call and ask if that's one of your questions.
Yeah. So let's see here. Barb from Health at Any Cost says, always good to hear from you both. And even though nothing huge, thanks for this news. So Laraine just did an interview with Barb's daughter from Health at Any Cost that will run later this week. So watch out for that. We also have interviewed Barb's son, Tristan. So it's a whole family. Barb's been on there. We'll have 3 of them. They're all fabulous, as you can imagine.
Yeah.
Josh says, in-office use of compounded tirzepatide will be available for up to a year after March 19th, as long as your doctor orders from a 503B with that 12-month bud date. Stay positive. Josh, I'm not sure that's the case, but you might be right.
I mean, I think it's
nothing has been said about sales of it. It's only been about distribution. Yeah. So we'll have to, maybe is the answer to that. What are you doing? I'm moving this over here.
Oh, all right. Well, then I can look like I'm. No, don't say leave this site.
There we go. Let's try that.
Oh, all right. Now I can look at what I'm looking at.
Yeah.
In office use. What's that? Like if you get it from a med spa or something?
Somewhere.
Will be available for up to a year.
Yeah. I'm not sure how that
I guess
works.
if they have vials with a year bud dates on them and they get them in right before March 19th, I mean, technically.
I haven't seen any statements about the sale to patients of dates. All of the dates that we've seen reflected are the manufacturer and prescription, our
Well,
delivery to.
yeah,
I don't know.
I mean,
Maybe you're right. Maybe you're
how are
right.
they going to know what
Well,
some
there's-
Mixod's doing in Idaho? You know what I mean?
Well,
Yeah.
Diana says hello from Seattle.
Hi.
Video Data's got a question for you.
What kind of bud dates do you normally see on your Mochi vials? About 6 weeks out, honestly, about 6 weeks out. And that's with a Keta pharmacy. I get shipped from a Keta pharmacy in Washington State. The pharmacy you get shipped from will depend on what state you live in. So
It wasn't 6 weeks, it was 6 months.
normally see,
on these 3-month ones
on
were.
the before the 3-month ones, which I
Yeah.
said were 6 months out.
Yep.
I normally see about a 6-week window from when they ship to on the 1 month supply. It's about a 6-week window, which is fine. 3 months is definitely better. And people have asked, well, what makes it different between, the 1 month supply and the 3 month? Why the longer bud? How can they do the longer bud date for the 6? You guys know what I mean, for the 3 month supply. And the answer is, well, we don't know, but there's different techniques that they use to put the lids on, and different techniques with, machines that come and do that. So there's less human I don't know, but there's ways. They have ways.
Donnie says she spoke with her Mochi rep, said no on ordering different doses. Remember,
Okay.
because all doses from Mochi are the same price.
Order the bigger dose.
And, you might have to do a little math.
Draw
but
out what you want.
That's
Yeah.
right.
Great time frame perspective on the court.
It's a moving target, but assume that anything that the FDA or that Lilly is involved in will move as fast as possible because they want this over. Oh, Josh says, sales rep, we are distributing until our pharmacy runs out. And they might be right, Josh. It's hard to say.
Gotcha.
We'll see what happens.
What's bud dates? My vials say expires on. Same thing. So bud date is a best used by date.
Yep.
So use it before then. Same as a expiry date or expires on. Like, you want to use it before both of those dates.
Yep. Let's see. We have 216 folks on there. Hello, everybody. Christopher Durham, Laraine Durham.
Please hit like.
Yep.
And subscribe to our channel.
If you're joining us late, we did a report on the OFA and the FDA case today out of Texas, and the long and the short of it was not much happened, but they did release some timelines, although they're a little fuzzy. Essentially, the court case is going to move forward. It could take anywhere from 3 to 6 or 7 weeks on the process. Go back and watch all the details of it, but nothing's moving very quickly. Nothing was banned. Nothing's stopping today. As of today, the timelines that the FDA had set out that they will not enforce, which were February and March for 503As and 503Bs, are still in place. We'll see what happens. That could change as the timeline moves on. So,
yep. We'll have to remain at the clinic in the fridge, though. It's not patient specific.
DJ Bosnik says Empower's bud is July.
So they've got about a 6 month window. Hi from Northern California. I've been on Ozempic for 3 months and no longer covered by insurance because my BMI is less than 40 and I don't have diabetes. Seems my only option is compounding.
Today, now, sleep apnea was just...
You had sleep apnea.
Yeah, sleep apnea was just covered by Medicare in the last, I don't know, we reported on it.
For Zepbound.
For Zepbound,
Do you have cardiac disease? Because Ozempic is covered for cardiac disease, right?
Yeah, so it's possible if you talk to your doctor and have comorbidities, there may be other things that they can help you with. But today, it's not easy.
Or go, or find an online provider that does compounding. And I switched in the middle of my journey. I had been on a different compounded provider for 3 months, and then I switched to Mochi. And I just told him that. I said, look, I've been taking these doses. I've lost this much weight. Because people are concerned if they switch, oh, can I still get it? Will I still be covered? Just give them your information. Give them, your doses and all that stuff. And they'll work with you. They'll work with you.
Your favorite. Shorty, thanks for being a member, Shorty.
I was just thinking about you today. Thanks, Shorty. I was just thinking about you today that I hadn't seen you around in a while. I was going through the Club Downsized members, and we have a membership for people who want to support us further. All of our content is free, but this guy is working hard 24/7 on his channel to the point I'm like, we have to do other things like grocery shop and laundry and like, I don't know, other things. So if you want to support us further, click the join button and you can see we have some membership levels. You get a cool thing like Shorty has there that shows her membership level, and some levels you get invited to join our Club Downsized members only Facebook group, and we have members only
live streams,
which this week will be on Thursday. So our regular live streams for all of the world this week is tomorrow, Wednesday, and then we'll have a special Club Downsized stream separately on Thursday. So we're splitting those up a little bit.
Yeah. So all right. So
P.S. This sweater came from Primark.
Primark is where
my new favorite store. When we were in Chicago, I just went through and bought like tons of stuff. So love it. If you have a Primark near you, they're great. I concur with Shorty. Thanks.
So
Vanessa.
she just had it done today. So
hours
color,
ago. Like it'll never like. I need to like take a picture. I did actually take a because I like, and I asked my hairdresser, I'm like, how do you, she like takes a flat iron and then just kind of rolls it back and then just zooms the flat iron down. But I don't know. I always tend to want to make my hair poofier.
Because you grew up in the 80s,
babe. I'm a, Gen X or child of the 80s. So I always think it needs to be bigger, but.
Anyway, so questions, compounded tirzepatide, the FDA case, the RFA case.
Compounded tirzepatide.
If you've got questions floating around out there, we'll take them for a little while. And then if you'd like to join us tomorrow at Wednesday at 7 o'clock Eastern Standard Time, let's see what question we have here.
Can you repeat the cost for Mochi and membership fee, please? Certainly. So their 1 month membership is the most cost-effective option. It's $79 a month. That covers your doctor visits, basically their membership fee.
A nutritionist.
And you can also see a nutritionist. You can see those as many times as you want to schedule an appointment. And then their compounded tirzepatide is $199 a month. And their doses are a little different than the Zepbound and Mounjaro doses. So, for example, the first dose of Zepbound and Mounjaro are 2.5 milligrams. At Mochi, the first dose is 2.2 milligrams. They're just making them a little different, just in case.
And so what's happening?
Get a little hairy later down the road with compounding.
Yeah. So what's happening with virtually all of the compounding pharmacies is they're looking at alternate dosing to attempt to stay within FDA regulations. A couple of people asked about this today. Mm-hmm. So alternate dosing and then alternate formulas. So maybe they're adding a B6 or a B3 or a niacinamide or whatever. So Mochi's doing the same thing. Yeah.
And so if I have a code, you can save $40 off if you use my code. When you use my code, I save $40 and you save $40. My code is QI. It's in the description. QIYGO8. Copy and paste because the O or the 0 gets confusing. So copy and paste. And they give everybody a code. Once you get your code, give your code to your friends because honestly, I have so many referrals at this point that it'll take years to use them because they only let me use like 4 per month. But still, it's still very good. So thank you for those who have used my Mochi referral code. But I encourage you to get that code and give it to your friends. Your own code to your friends and family. So thank you. Step away from the can of Aquanet, Laraine. It was like, did you ever like take the blow dryer and blow dry your hair back and then spray it like straight up That was the best. I want Big Hair to come back so badly. It will not, though. Mindy. Hey, Mindy. Hey. Good to see you. Mindy's a member of Club Downsized, as you can tell by her little special Club Downsized emoji next to her name. Finn from Within 66, also Club Downsized member. Thank you. Good evening. Thanks for keeping us posted. Love your hair. And Hallandale yearbud date. I miss those Thank you. I miss those Hallandale yearbud dates. Mochi and Hallandale parted ways months ago. So if you're with Mochi, you will not be getting shipped from Hallandale Pharmacy in Florida.
But they have 4 or 5 pharmacies.
They're a great one. Mochi uses Red Rock, Akeda. Is it Empower or Emerge or one of those?
One of them, yeah. There's several they use.
Yeah. If you do a 3-month supply, is there sorry. Yes, you pay 3 months up front. No, I don't think there's Klarna options. It's the 3-month supply. You have to change your membership to a 3-month membership, which I believe is...
There's a slight discount on the membership for 3 months.
It's a slight discount on the membership. It's not 79 times 3. It's a little bit less. But the 3-month medication price is $199 times 3, which is $597. And that is kind of like a big chunk. So, you can make those decisions, what you want to do there. Hi, Laraine and Christopher. I haven't been well. Oh, all right. Well, all right, Shorty. Well, thanks for joining us.
I hope you're feeling better. Yeah.
Okay.
We want that. So let's see who we have here. 233 people and 112 likes. Thank you very much. If you haven't hit that like and subscribe, please do.
Yeah.
So questions on the court cases. There's not a lot to say here other than no, things did not end. Compounding Tirzepatide did not get shut down. As of today, we'll still be able to get stuff through mid-February, mid-March, depending on which pharmacy you're coming through. Right now, it's all good. They did lay out a pretty fuzzy timeline. If we get more information on that, we'll certainly be back to you with that. Let's see here. Wonky donkey.
Has anyone had their medication lost in the FedEx hub in Portland, Oregon? It has been in the same location since Sunday. Mochi Health states it is stable in container for 8 days. We had this big snowstorm and my 3-month got a little slowed down by that. But so let's see, Sunday, what's today? Monday, Tuesday.
Mm-hmm.
Oh, you're probably good. So I've been seeing a lot of 2-day FedExes to get. It used to be a 1-day FedEx to get my medication. Now it's a 2-day FedEx, which, all right, it's still cold when it gets to me. So should be stable in container for 8 days. I think you're probably good. I would take they give you a tracking number. Maybe just contact FedEx directly.
Yeah, I would for sure.
What's going on? You can go on the FedEx website and put in that tracking number and get a more detailed, and maybe you've done that.
And Mochi will take care of you if there's an issue. So
when you get your medication, it should still be cold. Okay, so hopefully, if you're getting it from a Akeda pharmacy, it'll be in that blue thermos packed with the cold rods, and the good news is it's cold outside, so that's a plus. If it was 100 degrees outside, it might be harder. Christina, hey Christina, I'm late, but I'm here.
Wonky Donkey says, I have. So I assume that means you've had issues with that Portland, Oregon. So was it lost forever or did it just take longer? Would be my question.
I think with the whole snow situation.
Johnny says hers is around somewhere in Oregon too.
Oh, yeah. I guess, does mine go through Oregon? I don't think mine went. I feel like mine went to Memphis and
that's the national hub. I think there's a West Coast hub in Oregon.
Oh, okay.
Yeah, I don't know.
I would definitely keep an eye out for that.
Yeah, I would reach out to FedEx for sure. And Johnny says they're in Florida. Yeah, I don't know.
Yeah.
240 people. Hello, 125 likes. Thank you very much. We appreciate the support.
I'm gonna ship 2-day FedEx. I remember KM because you were, I think you were messaging me. Really, they're in these thermoses. If they're not from Akeda Pharmacy, they're packed in like these big cold packs with ice packs inside. I really don't think you have to worry. But when you finally do get your medication, look at it, feel it. If you have like a cooking thermometer or something, you can stick in there and get a temperature read. As long as what's the temperature? It can't be above 80 degrees.
Which it won't be.
Which it won't be. And you don't want it to freeze. So as long as you're in that range, but you want it to be cold. If you get it out and it's not cold, call the Mochi customer service line immediately. Speak to someone immediately. Tell them what's what, and hopefully they'll make it right for you.
So Eden says, "Hey, just joining. I want to make sure is compound tirzepatide going to be discontinued in February or March as originally scheduled, or has it changed? I really don't want compounding to go away." So
me neither.
Not much happened in today's court case today. Eden, basically, they didn't ban anything. They didn't make any decisions. The court didn't do anything other than tell us more about the process. Essentially, they're going to have to come back over the course of the next few weeks and go back and forth over complaints and arguments and so forth. As of right now, those February and March dates are still in place by the FDA, and that has not changed. The OFA did say, hey, if this is going to drag out, we want to revisit those dates. But right now, nothing's changed. So not much to say there. But, everybody wants to know. KM says, yes, I was. Thanks for remembering.
Sometimes I remember things. Sometimes. Phyton says, I'm concerned about using row when the temperature increases because they only use one small ice pack for shipping. Well, there you go.
Yeah.
I mean, there's other fish in the sea, so you could always call them. I don't know row or anything about them. I'd call them. I mean, that's definitely a customer service issue. They're probably just trying to save money. So if the product gets...
Yeah, I mean, basically the last... 2 weeks between snowstorms and now fires on the West Coast?
I mean, the whole world is
if you're FedEx and UPS, you're having a rough time. And there's not anything that any of these telehealth or compounding pharmacies can do about that.
Mm-hmm.
Let's see.
Mochi did reply, stated they will make good on it if it arrives later than they stated. Well, all right. So just, keep your documentation and hope for the best. I hope it'll be fine. I think just everything going on between the weather and California has slowed down all these shipping channels. So hopefully, the fires aren't contained, but the weather got better on the East Coast. So there's that. Who would you suggest for bulk ordering? Issue is that my doc can't order compounded meds. Any suggestions? Well, I use Mochi Health, and that's what I suggest. So you can go to joinmochi.com. You can use my code for $40 off your first order. The code is in the description. And
there's a link in the description too.
Yeah. So beyond that, I don't really.
Yeah, that's who we use, and they do 3 month supplies. So there is a video. Laraine kind of walks you through the last pack. And in fact, Dion just asked.
Oh, I saw your unpacking video of your box compound. Nice packing and installation. Right. I mean, it's really nice. Like the blue thermoses that they use, if you get shipped from their partner from Pharmacy Aketa. Red Rock. So Mochi owns Aketa Pharmacy. They don't own Red Rock or any other ones. So if you are getting shipped directly from Aketa Pharmacy, you get all the Mochi branded packaging and the nice blue thermos, and it's a little blue box. It looks like just a regular little box. Nobody knows what's in it. Some of the other pharmacies, like I think when I got a shipment from Red Rock, it was in this giant bubble packaging with like big ice packs, and it lands on your front door and you're like, what is this? So I definitely...
It all arrives safe and fine.
It's just
not as pretty.
Good. Right. Hi from Texas. Hi. Hey, LD and CD. I just had my visit with Mochi this week and submitted my 3-month prescription, and they said it wouldn't ship until 14 days. Well, that's the window that they tell you. They say the shipping can take up to 14 days, and it might very well take 14 days right now because they're probably busy.
How long did it take your last order?
I think it took... Oh, my last order was super fast.
Yeah.
It was like...
It was a 3-month order, right?
It was a 3-month order, and I think from the time I put it in to the time I got it, it was literally less than 5 days, but that was like the fastest ever. Usually it takes a good 7 days, maybe 7 to 10 days. I don't think they're packing anything on Sundays, so you can, factor that in. But yeah, that's what they say is give them up to 14 days, but watch it. Like if you don't see that order moving, like send them a message and say, hey, could you check on that order for me? I don't see it moving. And, squeaky wheel gets the grease and all that. So
yeah, I mean,
stay on it.
we're staying as stocked up as we can. I have a prescription for branded Zepbound as well, and I have stuff in the refrigerator. So I mean, we're making sure we have the medication we need to take care of.
We've got a lot of money in our refrigerator.
Yeah,
the power doesn't go out. But we've got ice packs, so it should be fine. Lady Be Lovely, it will be 2.5 weeks for me when it ships. When it ships for me on Thursday. Yeah, I mean they're busy, so you just have to kind of be prepared for that.
Piggy asks no more. Hello, Piggy.
Hello,
Piggy. When are you going to do an interview? Come on.
Are there any plans and works for live meet and greets?
We're talking about where do you
want to come on
live,
the Downsized
Piggy?
cruise? Have any of you been recognized as No. Wouldn't that be so weird if somebody recognized
We had some on the cruise we were on.
The MSC cruise.
Somebody walked by and said, "I know you."
No,
but they didn't stop. Yeah, when we were filming, and then they did, but they didn't stop. So, but no, not really.
I think they were. Well, anyway.
Meet and greets are certainly a continuing conversation, and I mean, we announced the cruise. So if you haven't seen all the stuff on the cruise, I'm not going to do a cruise commercial here, but it's on the website, thedownsized.org. Go check it out. That'll be June 23rd.
We're getting together a group cruise, so you're invited to come with us. Come check it out at thedownsized.org. You can get all the info there.
We travel a good bit for our real business, the real world business. So we may tie in something if we're in a city somewhere. So where are you? Barb says a meet and greet in Orlando, please. There's a lot of people in Florida. So, I mean, Florida wouldn't be surprised if we ended up down there doing something like that.
I could see us going to Orlando maybe in the fall and then go on a cruise after.
Yeah, it's very possible.
Don't have any plans for that at this point, though. Tamisha M says, Mochi is truly excellent. I ordered on a Sunday, received 9 days later, which was longer than before. However, it was packaged perfectly with 3 cold packs. So, what you want is for your medication to arrive safely. And that's happened every time with my Mochi. And I've been with them since February of 2024, so coming up on a year of Mochi, and I was using them a long time before they even reached out and said, "Hey, we'll sponsor you." So
this is not
a sponsored post. We do some sponsored posts for them, and we like Mochi. We're happy with them, so we recommend them.
So yeah, so to recap, nothing much happened. Everything's kind of where we were. The court did release some timing on things that you can go back and watch, but basically it says it's anywhere from 3 to about 6 or 7 weeks.
Mm-hmm.
We may get to some preliminary injunctions or summary injunctions. And actually, I think Laura was asking.
Just joking. Love the hair, Laraine. Thanks. Question: when using Lilly coupon without insurance company coverage, can you get a 3-month supply? No, I don't think so, because you can only use the coupon once every 28 days. So that's been my experience. So we've gotten Christopher some prescription through like the CVS and the Walgreens, and I have used the coupon. And don't tell anybody, but my daughters are also now both on Zepbound. So I've had a lot of experience like going to the drugstores with this coupon. I had to get everyone a new coupon starting on January 1st. And it's good for, what did it say, 7 fills, 6 fills, 6 fills for the calendar year.
No, it wasn't the calendar year. It was the first 6 months.
And then I think you have to get another coupon. So last year in 2024, with the coupon, we were paying $550 per month. And now with the coupon, it's gone up to $650 per box per month. So we're trying to move everyone to compound. That's that's the direction we're headed because
If it exists, yeah.
we're not wealthy people and we're racking up some credit card bills, in all honesty. So, you know what? But it's such a life-changing medicine. I've lost over 50 pounds. Christopher has lost over 90 pounds.
94. Mm-hmm.
My youngest daughter has lost close to 90 pounds. So it's, I mean, what wouldn't you do to give, you know, your spouse, your children, this literally life-changing medicine that's going to make them healthier? So it's our story. They're going to be mad if they know I told this to the world.
Don't tell anybody. Mingle Maid says, with your 3-month supply, we can read. Or so let me step back there. So there's two different conversations happening here. There's a branded Zepbound conversation, and there's a compounded Mochi conversation.
Yes.
The branded Zepbound, although your doctor can write a 3-month prescription, I don't think the coupon works for 3 months, but we're not experts at that.
I've never tried that. But
I don't think it does. The Mochi conversation, which they have 3-month prescriptions, do we know when you can reorder on that?
they just came out with it. So I literally just got that box, last week? Was that just last week?
Mm-hmm.
What's today, the 14th? It was after the first of the year. So it's been within the past 2 weeks that I got my first 3-month supply box from Mochi. I honestly don't know. I mean, if I was thinking as that February date creeps up, maybe I was figuring I'd try at the 6-week mark, because you have 3 months of medication, which is really 12 weeks of medication. So I was thinking I would put in a reorder at the 6-week mark, which would put me like into February. So I don't know. They've never told me at Mochi that no, you can't order. It's too soon. You can't reorder. They've never told me that. So put in a reorder.
But you can go try. You can go.
Worst they can say is no.
Yeah. You can go try it, and it's either available or it's not.
Yeah.
KM says, I just had an ad for Mochi Health during this streaming. So it means the algorithm's listening, but we don't have any control over those ads. So
No,
it could
isn't
be,
that funny?
and honestly, you could all see a different ad because it's based off of your browsing and what you do.
Usually when I'm surfing YouTube, I get, GLP-1 ads or different ads like that. I was watching an Oprah video today that was talking about GLP-1s, and it was an ad for like St. Jude or something. It was like this heartfelt, like, child father, and I was like, oh, this is a different ad that I don't usually see. But yeah, it's funny how that algorithm works. Tamisha says, Mochi Rep told me I can't use my FSA card for payment. I wonder why is that? I use it at, let's say, CVS. So FSA is your savings card, your I don't know.
Yeah, my understanding is because those cards are typically used for, they're pretty complicated to set up in a system, and they're used for a lot of other things than just this.
Yeah.
It's more trouble than it's worth if you're not a Walgreens, a CVS, somebody who has the system already in place.
Yeah, so an FSA card, that's when you go to Walgreens and I can get Advil and I can buy it on my FSA card, because it's one of those drugs that falls under, one of those things that falls under the FSA. It's like over-the-counter things. And I guess Mochi's just not set up for that or coded for that. Yeah, that's a bummer.
Let's see here. Oh, Wonky Donkey just became a member. Thank you for joining, Wonky Donkey. We appreciate it.
That's a fun name to say.
It is.
Wonky Donkey 555. I guess there was Wonky Donkeys number 1 through 554. Chrissy says, please interview your younger daughter. I know.
She's not going to do it.
She probably won't.
They have no interest in being on the channel, and they're embarrassed. They're like, Mom, Dad, you're so embarrassing. What are you doing?
But she's doing very well. And she has a problem eating enough a lot of times. So I'm a little, she's away at school. So I worry about her eating enough. So, but yeah, I think maybe when she gets to the end of her journey, and I think,
maybe
she's not near the end yet, so she still has a way to go. So when she gets to the end, who knows? Maybe she will. I'd love for her to. So.
Yeah. Let's see. Does anyone understand the logic not being able to use the Lilly coupon if you're on government insurance? I have Medicare and TRICARE. I won't say I understand the logic, but I can tell you what it is. I don't So basically, there are laws in place that prevent corporations from incentivizing the government and government recipients because they see it as graft, as a bribe, and they count coupons in the same way like that. Now, is that logical to me? No, it's not. But there is that law in place, and that's how it's interpreted. I think that's one of the many things that we need to reevaluate with our healthcare system. It's all just kind of broken, and unfortunately, Medicare and Medicaid patients are getting the short end of the stick on a lot of this. If you saw the
Sleep
video,
apnea.
yeah, if you saw the video I did today, if you didn't, go ahead and watch it, because there's a whole initiative trying to help Medicare and Medicaid folks get these medications, and there's a way for you to go sign up and be active and be a part of the conversation. So please check that out. I mean, I just posted that, I think, at 2:00 today. So,
well, I was getting my hair done. I came home and said, "Oh, you posted another video." And how do you like my hair? Have you all heard of CVS Caremark requiring you to sign up for their weight loss app for them to keep covering? I have not heard that yet.
But there's a lot of insurance companies and PBMs that are requiring weight loss programs. It could be their own, it could be Weight Watchers, whatever. And because basically they're going to make people jump through hurdles to get to this medication. It often also includes some of the lesser weight loss medications.
The older.
Some of them are lesser too.
Yeah, well, yeah, like the Victoza and Rybelsus and
metformin, and I mean, there's some other ones that they're like, well, did you try this? You have to do this for 3 months and show this.
Yeah.
And I mean, they're doing everything they can to put hurdles in the way of people actually treating effectively their obesity.
Yeah.
Again, another thing we need to fix. Let's see here.
CVS Care sent me a nasty letter to keep getting Zep covered. Yeah, well, you know what? They're trying to keep their costs down, so you just have to come back at them just with what you got, and get your doctor's prior authorizations and all your everything. Our friend Barb, Health at Any Cost, did a great blog post on how she got her Zepbound, was it Zepbound or Mounjaro, covered by her health insurance. She figured out, or she had someone tell her, that an AI scans your letter. When you send a letter to the health insurance, usually a human doesn't read it. So you have to make sure you put a lot of keywords in the letter so that it gets read by a human. But go to her blog, Health at Any Cost, and you can check that out. You may or may not know this, but here goes. I'm looking to find the best possible price. So if I switch to Mochi, will I have to start over with my dosage? Probably not. You'll talk to a doctor. You can tell the doctor your healthcare history with another telehealth provider. I always tell people, tell your doctor everything. Don't be afraid to tell your doctor your healthcare history, because it's important, right? They want to know what you've been on before. They don't want to prescribe you 2.5, 2.2 milligrams of compounded tirzepatide if you've been taking 12.5 or whatever. So tell them your weight loss pattern. If you've kept a chart, if you have a app on your phone, maybe go in and write some things down so you can tell them. And the more information you can present, the better.
All right. Tell it like it is. FDA reports 217 deaths linked to compounds. GLP-1s, I know real tirzepatide is crazy expensive and that needs fixed, but compounding is not the solution. Well, let's talk about those numbers for a minute. First of all, the FDA has a reporting system called the Adverse Events Reporting System. I don't know where they're getting these 217 numbers from, but compounders are not required to report these, so it's hard to say where those numbers came from. But if you want fun, you can go back, and I did a whole video on that Adverse Events Reporting System, and it shows you the link. If you send me an email on our website, I can send you the link, and you can go search and find out things like semaglutide also has deaths attributed to it. I'm not going to quote a number because I will get it completely wrong, but it's been out 20 years, so it's quite a few.
Semaglutide has been out 20
The
years.
other thing you can do is search silly things like Advil and see how many, and you'll be terrified. The thing about that adverse events reporting system is it does not prove causality. It
Right.
simply says somebody reported something happens.
Right.
Doesn't say there
This
was
the cause.
a medical report from a coroner that said this
cause of
caused
death
this.
was X. Yeah. No.
It says something happens.
Yeah.
So those numbers are really fuzzy, but please, if you want, I can send you the link, or if you go back and watch the video, you can go yourself and look at all the numbers on any medication you want. It's all there.
Well, and we also need to tell people that these compounding pharmacies are regulated by the state, by each individual state. So they're not just out there, some guy in a back room mixing up like they have to go through these state regulations. Also, you want to, if you are getting from a compounding pharmacy, do a little Google search on your compounding pharmacy. See what their certifications are. See if anybody has reported, bad things about them. Like, know who you're getting your compounding from.
Yeah, and be careful. I mean, we have reported and we will continue to report where there are bad players in the market. We talk about them and we report them. Where there are crazy ladies on Instagram and TikTok selling what effectively are bad Chinese copies like Louis Vuitton knockoffs and hurting people. These are prescription drugs. Work with a doctor or a real prescriber. Work with a state-regulated pharmacy or your local pharmacy. There are ways to protect yourself. The reality of compounding was it was never designed to work at this scale. So is it a permanent solution? No, it's not. I don't. You think it's a permanent solution? It's not. Things are going to have to change, and our system has to evolve. But today, this is the system we have.
Right. So what we, I guess, hope best case scenario is there are many versions of these GLP-1 drugs in clinical trials right now.
There's like 600.
A lot. This medicine is like a gold mine for these pharmaceutical companies, right? So everybody is rushing to develop and get these tested and get new ones trialed and get them to market. So in the next 2 or 3 years, I mean,
there might be an oral out by the end of next year. Honestly.
There's going to be a lot of more competition out here for these GLP-1 drugs. There's going to be better versions. There's going to be newer versions. There's going to be next generation. There's just going to be other avenues. So, the more competition there is, the more competition these companies are going to have to, hopefully it drives the price down because there's more competition.
Yeah, and what happens is the more manufacturing that comes online, the more volume, the more capacity, the more, when all of a sudden an Eli Lilly or Novo Nordisk or Viking or whoever the next one is has 1 million doses available, they want to sell 1 million doses available. Promise you the price is going to come down. When they all of a sudden have orals available that have the same effectiveness because they figured out bioavailability, not doctors.
They aren't out yet.
And there are some orals, but they're not as effective. And there's no oral Tirzepatide that's legally out. It allows the price to come down because turns out manufacturing orals is a lot cheaper. There's no cold supply chain. There's no refrigeration. So it'll come down eventually. Who knows?
We just want to hold on until then.
Yeah.
Chantel says, my daughters have also just started. They are both starting with semaglutide. I'm on Tirzepatide. I bought a bottle at Christmas time for $900. I'm pretty sure it will last me about 3 months.
Yeah.
My youngest started with semaglutide because she wasn't old enough for Tirzepatide. You have to be 18 for Tirzepatide. Semaglutide, I think you have to be maybe 14. And it made her really nauseous. Like we had to get a prescription for the nausea. But luckily she was only on that maybe 3 months until she turned 18. And then she switched to Zepbound. And then it was like she was off to the races. So, keep that in mind for your kids that might be looking at this medication.
All right. There's 293 people on right now with 164 likes. I think that might be the most people we've ever had on at one time. Hello, everybody. Good to see you. Christopher Durham, Laraine Durham. Court cases happened. Nothing much happened. Dates are still in place. If you want to go back and watch the beginning, I read through all the news. But essentially, the February, March date are still in place from the FDA, and the court laid out a fuzzy timeline that could potentially extend those dates depending on how the rulings go in preliminary injunctions or summary injunctions. So It's all good. Please like and subscribe. We'd love to get to 200 on this. Rose.
MJ QuickPen is now available. All doses except 15 milligram, which will be available. How do I get a ship? Can I get a shipment from Canada?
That's one of these.
If I live in North Carolina, is there a company that will ship from Canada to me? Is that possible? So a QuickPen is like, we got one. Somebody from the UK sent us one, and it has, you dial your dose. And there's a bunch of nuances to it, which I can't tell you about, but it's a multi-dose pen, right? So what do you put on a different needle on the end?
Yeah, there's a little needle that pops on.
Yeah. So like when I did Saxenda years ago, it was a daily shot and you got all these needles. It was one pen, you stuck the needle on, and Saxenda didn't really work that well for me, but Tirzepatide works great.
And it's hard to say why these weren't rolled out in the US. I think it's a function of the plants that were already in place.
Mm-hmm.
But, you know.
Does anybody know how to get shipment from Canada? Curious. They assume those of us on government insurance will have our meds paid for already. So why would you need the coupon?
Oh, she was referring to the coupon.
The whole Medicare thing. Mm-hmm. Yeah. And that's Barb Health at Any Cost.
Yeah.
Who got her insurance to approve her medication. So go read her blog. It's very inspiring. Oso Blue, is it hard to apply for the coupon? No, you just type in your name and your email and your date of birth. Boom, there it is. It comes shoot straight to your email. You print it out. You take it to CVS. I started applying for it and then chickened out.
It's super easy.
I wouldn't worry about it. Currently taking compound with Mochi, just exploring all options in case compounding stops. Yeah, so when Christopher first went on Mounjaro before Zepbound was out, before it even came out, the coupon for Mounjaro said you had to click a box that said, yes, I am a type 2 diabetic to get that coupon. So with Zepbound, there's not, I mean, it's for obesity, for weight management. So there's no box to check, but I mean, do you want to read the things? I mean, they have your name, they have your date of birth and your email. Okay, like everybody in the world has my email address.
No, you're not even really applying. Nobody approves it. It's just
automatic.
You give them your data, they give you a coupon.
Yep.
And given that it's basically a $600 value on a coupon, you probably want to do that.
Yeah. Eden says, what do you think will happen if compound meds will be discontinued? This is, I don't know. Do you feel like people will pay the super high price of the Zepbound Mounjaro pricing or demand for compound?
Well, here's the thing. I don't think a lot of people will be able to pay the price. What I do believe is the ones that will be able to pay the price will almost immediately push Zepbound and Mounjaro into shortage again, which would mean that compounding would
come back.
Because compounding can happen legally right now.
If the drug is in shortage.
If the drug is in shortage, or if they do something customized to make it a true compounded. That's what a 503A does. We'll see whether the custom dosing and the additional vitamins and so forth hold up in court. I don't know. I'm not a lawyer. I don't know whether that's going to hold up in court or not.
Might be good,
but they're trying.
I think it'd get a stay of execution, as it were. You know what I mean? So I don't think we have to panic about compounding. If you can get a 3-month supply in the fridge, I'd get you a 3-month supply. If you can't, just keep ordering every 3-ish weeks or so, and
because honestly,
order the top dose.
Our strategy is to hold out and stock up as much as we can, because I firmly believe, and everybody argues, oh, the price will never come down. I believe the price will come down.
Maybe
on the branded stuff. I just believe it will. I believe that Eli Lilly and Novo Nordisk are going to look at the 74% of Americans and almost that percentage in the rest of the world and go, we want all of them. And their sheer greed is going to make them lower the price when they can manufacture enough. They're going to go, if this were $200, I could sell it to 74% of America, and they're going to lower the price.
So that's a great statistic. 74% of Americans have overweight or obesity. And now we say you have overweight or you have obesity, not you're overweight or you're obese. We don't say that anymore. So we're changing that. You have overweight, you have obesity, like you have high blood pressure or you have high cholesterol. I'm reading a very interesting book called The Ozempic Revolution. We're going to have an interview with the doctor who wrote this book come out this week. She has a very interesting statistic in the book, so now I'm reading the book. In 1980, the obesity rate in America skyrocketed. Something happened in 1980. Was it seed oils? Was it ultra palatable, high processed food? But it, jumped like that. And it's so interesting. And now we have 74% of America with overweight or obesity. So, obesity is a disease. And, we need these medicines to combat this disease.
Let's see here. Oh, there you go. Health at any cost is Barb. So I think one of you guys had asked what health at any cost was. That's one of the YouTube folks here.
Yep.
DJ Bosnik uses Empower. Yeah, they use 4 or 5 pharmacies depending on where you live. Each pharmacy has to be licensed to distribute to a specific state. I also suspect they may use them if they're getting full up on one pharmacy to make sure you're getting stuff out. So it kind of is what it is.
Depends on your state.
Yeah.
DJ Kathy says your hair looks really. Oh, thank you. I just got it done today, so maybe I can try to replicate this. I'm trying to let the color kind of go back to not a more natural color, but a different color. But thank you very much. That's very nice of you.
Oh, Mr. Jamaica 67 says cost down. They're getting 70% back. Well, they're not really getting 70% back. If you figure the Congressional Budget Office estimated this stuff costs about $5 a dose. Their markup, even at $6.50, is a lot more than that. If we could get rid of PBMs, which are accounting for about 74 cents on the dollar, that could dramatically change the cost. And there's certainly some bipartisan, there's certainly some bipartisan interest in doing that. So we'll see. They haven't always existed. That's certainly something that could happen.
Mm-hmm. There are laws on the books that don't allow coupons.
And we talked about that.
Yeah, that's a bummer. At KM, I'm going to give it a try. I understand the membership fee being excluded, but not the meds. Oh, is that for the FSA question?
Yeah. Tell it like it is. Says, thanks for answering and not skipping a critical question. You make a good point. I think there's certainly reason to be concerned about the safety of compounding pharmacies, as there is about the safety of national brands. And if you go look at product recalls across the board, it's kind of terrifying. So our manufacturing needs to be appropriately regulated and monitored. We still got a long way to go on that. So know who you're getting your medication for. Know it's a prescription. No question about it.
Black market compounding is what is not good. Yes, Barb, we agree 100%. 503A and 503B pharmacies are real pharmacies. And you don't even have to put it in quotation marks. They are real pharmacies. Med spas that make their own are not safe. I would not recommend buying your compounded medication from a med spa. I have several friends that have done it. I've switched most of them to Mochi. I would get it directly from a compounding pharmacy. So yeah, I agree, Barb.
So yeah, there is a whole what they call gray market, black market out there of people buying powders and potions on the internet from China and other countries and India, and they're completely unregulated. They're called research grade. Mm-hmm. Both the FDA and Eli Lilly and Novo Nordisk going after them hard. They are completely
As they should.
illegal.
Mhm.
They are all labeled not for human use, not for human consumption. I know there's the brave or the fools. I don't know which ones you are
If you
out
have
there
a,
doing it, but please don't.
if you have a vial labeled not for human consumption, do not inject it into your body, please. I mean, this is serious. This is serious stuff here. We don't want anyone to have a problem. Christine Manigan says the pipelines are full.
Yeah.
Crochet made it. Hey, yeah. Where did you tell me that picture's from? It's
Denmark or
famous,
Finland.
It's a famous statue.
Yeah, he and I were talking on a cruise channel actually. He said he's going on like a 6-week cruise. I don't know.
That sounds.
I assume it's
delightful.
I don't know what, but I think so. But yeah, it sounds delightful. Tammy Parker, how do you know if it's a reputable pharmacy? Well, it depends on which pharmacy you're talking about. So if you're talking about your local one, when those are all regulated appropriately, so the CVS, Walgreens, Costco, all those guys. If it's a compounding pharmacy, number one, they're state regulated, right? So you should be able to go, and there's a link on our website, thedownsized.org, to the FDA, and there's a list of stuff that will take you directly to your state, Utah, Arizona, wherever, and you can see who's regulated. You can also see if they've had any actions against them, very similar to like food health inspections, A grade to B grade, whatever. You can do all of that. And then the more you get involved in this community, the more you'll see common answers to these compounding. So Akita, Red Rock, Hallandale, Emerge, and I won't tell you everyone, but there's probably 8 or 10 of them that are pretty well recognized.
Mm-hmm.
There's a lot of users on, and a lot of people feel comfortable.
We've gotten compounded medications, just us personally, from Hallandale Pharmacy in Florida, from Red Rocks Compounding Pharmacy in Utah, and now Akita Pharmacy in Washington State. So I know those 3 are good. I've used them. I've tried them. Christopher's used them. So anyway, those are the ones I know about. But yeah, I'm in Chicago. Sheila with an H. I did my research and found a great CP in Michigan. My GP, what's a CP?
Compounding pharmacy.
Oh, my GP wrote the prescription, and I have 12 refills. I'm on maintenance, 1 milligram weekly. That's not very much. 72 lost and 60.
Well, I think that's probably semaglutide. That's a semaglutide dose.
Is it?
I bet.
She's 72 and lost 66 pounds, been maintaining for 4 months. That's great. So if you can get your doctor to write a prescription directly to the compounding pharmacy, I have a friend that tried to do that, and your doctor has to be set up with the compounding pharmacy. So if they have that relationship, then...
And I mean, that's a major city, so you're going to have some different resources than a lot of people
have.
A
lot different than Huntersville, North Carolina, and Chicago, right? So yeah, well, that's great. So, yeah. Brochet says, remember, correlation is not causation, right? 217 deaths could be from people that could have happened to have been on compounded, not because of compounded. So that's A doesn't necessarily cause B. It just happened at the same time.
I mean, the unfortunate thing when we look across all these medications is because there are so many associated comorbidities with obesity, you just see deaths that happen. And it's terrible, but people can die from sleep apnea, believe it or not. You stop breathing, people can die from cardiac problems, people can die from liver disease. There's so much that happens that the reason these drugs are so exciting is we see research after research that says it's helping. And I know it from real life because was able to go off of my blood pressure medication. I've been able to go off of my cholesterol medication. My what was undiagnosed sleep apnea, but my wife will swear by it, is gone.
You were snoring a little bit this morning.
I've been congested. I think I've had a little bit of cold.
Yeah.
But
the disease of obesity causes so many other diseases, right? Author the book I'm reading is listing all these diseases caused by obesity, and it's just like.
So I've actually been working on some scheduling for a series with a gentleman who's a scientist that works with obesity and cancer,
Mhm.
that he's going to come on. He actually presented at Obesity Week with his partner that has been in and around the drug industry and the pharmaceutical industry and all of that for years. Super smart guy that's going to come on and do an interview and talk to us about obesity and cancer and kind of do a monthly series on various comorbidities and things
Yeah.
to really dive in, because as we say, we're not doctors, but this guy knows what he's talking about. So you'll see some more stuff like that. Laraine mentioned we've got an interview with a doctor that'll come out on Thursday who just released a book. Trying to bring you guys better information, deeper information.
Yeah.
And honestly, we're a husband and wife suburban couple who have taken Tirzepatide. We're not doctors.
Well, and I love talking to actual doctors that actually have obesity medicine certifications, because you learn something new. It's nice to get some of what we've been saying validated. Some of these things we thought were true actually be validated by a doctor, and then to be able to ask some questions that nobody really seems to know the answers to, like, well, what about maintenance? What am I supposed to do? So watch that interview on Thursday with Dr. Sowa. Hope you'll tune in for that.
Yeah.
Hit the subscribe button so you'll get alerted, or you hit the subscribe and then hit the bell, and then when I post it or when Christopher posts it, you'll know.
Yep. SA says hello, just catching up. So catching up on the court case, nothing much happened as I kind of expected. But we came back to tell you anyway because everybody's nervous, right? So compounding did not end. Don't worry about it. The February and March dates that were issued by the FDA a month or two ago are still in place as of today, but the court did include in its brief, and it's in the earlier part if you want to go back and watch. There's a lot more detail. I can't remember it off the top of my head. But basically what it amounts to a series of multiple week back and forth between the plaintiffs and the parties to the OFA and the FDA on briefings and summary judgments and all this stuff. So it has the potential to extend this significantly, but right now it's kind of the same dates we already knew.
Mm-hmm. At Health at Any Cost, thank you. I've never heard of 503A or 503B before. I will look into it. Yeah, that's just the two different types of compounding pharmacies. I always get confused which one is which, but one is like a big manufacturing one that makes for the hospitals, right? They're making stuff in mass for hospitals. One is a smaller one that can make more personalized dosing, maybe can add B vitamins, say, hey, Laraine needs a 2.2 dose and add some niacinamide. And
that's a 503A. And 503As are in most local communities. There's usually a nice fellow or lady that owns, ours is called Neil's Compounding Pharmacy.
I talked to Dr. Neil.
We talked to Neil. So if your kid is allergic to something in the medicine, if they need a flavor because they can't take it, if they can't take a pill or they need a liquid version, there's all these things they can do. And a lot of people will get it for their pets as well. Those have been around for 100 years. There's nothing new there. And a lot of these pharmacies are 503As. They will be able to continue. 503Bs really can only manufacture in mass in times of FDA shortage. So we'll see. I'm not sure what Eden's question was. Let's see here. Hello from Pleasant Hill, California. I think that's the home of Safeway.
He knows where all the grocery stores are headquartered.
Christian Mangan, who's a member, says, will Lilly really report a shortage? Probably not. But I think the reality is if
they did initially, right?
They did. But are they, I mean, do they want to tank their own stock price is the real question. Right. So now their stock dropped 8% today, and they came back reporting basically their numbers weren't as good as they thought they would be, largely a function of out of stocks. So there's other reporting mechanisms that could force them to say, and if they go to Wall Street and say we didn't make our numbers because we were out of stock, they can't then tell the FDA, hey, we're in stock.
No shortage. Yeah. So they're in business to make money. We don't fault them for that. Woodkirky says, you guys are so right about a broken system. It's sad when people are actually happy to get a type 2 diagnosis so they can get the meds covered. I know, right? We must do better as a country. Yeah. So, and if you're type 2 diabetic, you absolutely should get this medication covered. And, some of the things that we say may not apply to you if you're a type 2 diabetic. So be sure you work with your doctor. But yes, we want everyone to have access to Zepbound and Wegovy, but it's sad. Thanks for your info. You guys are always so well informed. I know it takes work, but no, you are appreciated. Well, thank you very much, Shelly S. I think you are a Club Downsized member, so we thank you for that. And we hope everyone will like and subscribe to our channel. It really helps. That old algorithm. We're over 8,000 subscribers now. We've been at this just since March of 2024, so coming up on a year of our YouTube adventure.
Journey. Look, Tamisha became a member. Hello, Tamisha. Thank you very much.
Thanks for becoming a member. If you want to become a member, click the join button and you can get all the details. We appreciate it.
Let's see here. Oh, Sheila says, and people, you put comments up. So not true. The pharmacy had a form for the doctor to fill out. She is not affiliated with the pharmacy. Find a good local CP and try it. Can't hurt. Well, so here's the thing, Sheila. You live in Chicago, which is a major city. A lot of folks do not have access to a local compounding pharmacy. Even in Charlotte, North Carolina, where we live, our local compounding pharmacy, Neil's Pharmacy, we know have met Neil, doesn't actually make this medication. He would order it from Hallandale.
He was ordering compounded Tirzepatide from Hallandale. We'd be glad to resell it to me. And I'm like, well, I can get it direct for a little bit cheaper, Dr. Neil, but thanks.
So I'm sure that's true for you, but it's not true for everybody.
Yeah. If you're in a big city, that's definitely a thing to try. Mindy M says, does Dr. Sola talk about her soul products during the interview? We didn't talk about them at all. I think she told us about them and we're like, yeah, you can talk about them. And then she didn't talk about them. Several of my TikTok friends are using them and really like them. I think she's sending us some for
They are sending us some samples to try. So we'll do a review. We'll let you know.
Yeah, we'll try them and let you know. And, there's a lot of people out there selling a lot of supplements and things. And we generally don't go any kind of supplement route beyond a multivitamin. Sometimes I take a fish oil.
Got a whole
I take a calcium
counter of
I also have biotin.
You generally take all kinds of stuff. I take a multivitamin.
I mean, I just take vitamins I get at CVS, like, I don't know, that my doctor said, hey, take a fish oil. It helps with your heart health and blah, blah. So and
you've got Mago 7 and you've got all kinds of stuff.
It's true. Maybe I should look at these supplements a little closer.
I can tell you'll see the interview on Thursday. After listening to her talk about her experience, and I would even try these because I thought she was impressive. Are they good, bad, or indifferent? I don't know. We haven't tried any of them, and I don't know.
She was speaking my language, 100%. That's for sure. Wonky Donkey 555. The words from Dr. Fatima Cody Stanford from your review of Dealbook Summit video last month speaks volumes. Yeah, I love her. Like, she's on the Oprah things all the time, or the ones we've seen. 75% of Americans have overweight and obesity. Thank you for covering this interview. Yeah, so we did, what was the name of that video where we did like a reaction video to her talking to the CEO of Eli Lilly?
Rick's. That was the Dealbook Summit. Yeah, that's what.
But what do we call? Like, if people want to go search it, how would they find our video?
It's
been a few months.
Yeah, I don't remember what that was called. But if you go back and look, there's a picture of it on the front.
Yeah.
MK Sense Oil Snake. I don't know what that means.
Snake oil?
Maybe. I don't know. Hard to say.
Crazy Cat Lady in LA just got Dr. Sella's book over the weekend. Looking forward to the interview. Yeah, I just started reading it. I'm just probably going to have to do a whole book review. So much good stuff in there. So much good stuff. So yeah. It's called The Ozempic Revolution. We have a link to it on our Amazon store. We're Amazon affiliates. If you want to go to thedownsized.org and click store, got a whole bunch of products linked. I've got a link to, did you put the link to my bookstore? Is it linked now to the bookstore, to the Amazon store?
Yeah, it's all in there.
Yeah. Mm. Well, because I have my book club books and things that I've other books I've been
It's your whole
reading.
Amazon story. The whole thing's there.
So go look. Go look at it.
Mhm.
If compounding is halted in the short term for those of us who are not stocked up for the year, what will our options be? It's a great question.
Well, your options are going to be more expensive.
Yeah.
Essentially, you can switch to the branded, so Zepbound or Mounjaro, in which case you need to talk to your doctor. And maybe you have a comorbidity that will pay for some of this, type 2 diabetes, sleep apnea, you name it. You can switch to semaglutide. It's also being compounded right now very inexpensively. That could suffer the same fate as Tirzepatide, I would assume.
Should we talk about splitting pens?
Well, no. You could also switch to that branded, so Ozempic or Wegovy. You can switch to liraglutide.
Well, then there's the Victoza and Rybelsus.
Right, Victoza and Rybelsus. So basically, you need to go to your doctor and talk to them about all of the options. In fact, I would just go ahead and do that anyway. Because there is you can put plans in place, and some of them are less expensive, but they're still not as inexpensive as compounding.
I just feel like when that time comes, I mean, it's not going to stop on like 2:00 on a Tuesday.
No, it's not going to.
You know what I mean? Like we'll know, and we'll be able to ramp into whatever.
But start planning today.
Well, are we planning? What am I planning?
Are you kidding me? You just bought 3 months worth.
Well,
we have a refrigerator full.
I'm trying to stock up. You know what I mean? Like that's my plan for now.
I also have a branded prescription. So
yeah, but we can't afford branded times. All of us in our family. Well, I understand. Like we're there with you. So we'll.
Safeway is in Pleasanton. You are correct. I misstated.
Oh,
sounds remarkably similar.
I hope they're not in the fire zone.
I don't know.
Well, my fellow rock stars. Joining late. Sorry. All right. So yeah. So they had some court stuff today. Nothing's really happening. Like and subscribe, and we'll keep you posted.
Yeah, more to come. Go back and watch the beginning if you want the details, because
he read the whole.
I read the whole court stuff. Yeah. Eli Lilly from Wonky Donkey CEO. We can lower the prices of GLP-1s at Mounjaro. Yeah, he says it. Rick says it.
He wants they got it FDA approved. Zepbound's FDA approved now for sleep apnea, and that's one thing he talked about in that video. He wanted to get it approved for more comorbidities so that more people could have access.
Well, I think what he says in reference to that in that video is that if the government will commit to a certain number of doses, basically what's happening is Japan and England and all this are because they're using their national health systems. They're saying, we'll buy 100,000 doses, we'll buy 1 million doses, and they're negotiating against volume. And what he's saying is, well, you give us the volume, we'll give you a better price.
They can't handle the volume.
No, they can't. And if you get rid of PBMs, you get rid of 74 cents on the dollar. So,
PBMs are the worst. Like, whoever knew what a PBM was this time last year? Not me, that's for sure. Book club, Laraine. Yeah, maybe we'll have like a Zoom. Can we do that? Like a Zoom book club discussion?
We could do something on the computer, sure.
Something on the computer.
I don't know if it'd be Zoom, but something. Yeah.
Yeah, something. Yeah, we'll do that. We'll do that.
Black Squirrel, I think we probably have restated this, but if not, yell at me again. Auntie.
Auntie. There are so many compounding pharmacies near me in Fort Worth selling GLPs, but I still have switched Mochi because I'll get 3 months worth for the same price as 2 months, including the subscription.
Yeah.
Just, you have to price shop. You want to definitely get the best price.
Well, and what happens, and that's how our compounding pharmacy here is, because our compounding pharmacy does not actually make the injectables.
Dr. Neal's compounding pharmacy in Huntersville, North Carolina.
Right. So our specific one does not make the injectables here. He will order them from a Hellendale or a Red Rock or wherever, and they get in, and then he marks it up, because he's in business to make money.
That's what he does.
Right. So, there's a piece. So there are local compounding pharmacies that have the facilities to make injectables. They're much fewer and far between.
Like if you're in a big city like Fort Worth, Texas, you have that. In Huntersville, North Carolina, we don't got that. We don't.
I mean, Dallas Fort Worth is
it's
a huge metro area.
A huge metropolitan area.
Yeah. Kim Rogers says, from your Fort Worth neighbor. Hi, Auntie.
Laraine, your face looks even more slender. Oh, thank you so much. I lost my 4 pounds of Christmas weight.
Well, it's framing your face different
it
too.
Does. It does. It does. Thank you. Thank you.
So there's 261 people currently on, and we've got 228 likes. Thank you very much. If you haven't already liked and subscribed, I do think we're going to get out of here about now. We will be back live tomorrow for our regular live. You can come ask whatever questions you'd like. We can chat.
Yeah.
Have fun. We'll probably give you some more information on the Downsized cruise. If you'd like to learn more about that, go to thedownsized.org. OKM says the stream they were talking about is Unpacking Oprah's Weight Loss Special, Our Insights. That's a different one. I think the one they were talking about is an Eli Lilly one where we commented on it. But that one is really good too.
Dr. Fatima from the Oprah special was talking to the Eli Lilly CEO. Yeah, there's several. Go watch all of our videos. But, you know,
okay, no, Cam, that's a good one. That's one of the very early ones. It still does very well.
I think I'm wearing like a blue sweater, and my hair looks kind of similar because I got my hair done that day too. And we talked about the Oprah special. That was just like a revelation. Like that was in March of 2024, and that was when I first heard that obesity is a disease. Like, huh? Like it's not just me like wanting to eat all the time, and I'm just at the moral failing on my. No, it's a disease. That was just kind of mind blowing. So, if you haven't heard that before, obesity is a disease.
And we have another new member, Beth Jennings. Thank you, Beth, for being a member.
Thanks, Beth.
We appreciate it. All right, so let me walk through a couple of things, and then we are going to get out of here. So if you haven't already, please like and subscribe. Let me turn that off.
Please like and subscribe, because people always think, oh, it's so overwhelming, this problem I have with wanting to eat all the time, and it's just me, and what am I going to do? There's millions of people with this disease of obesity. 74% of America has this disease of obesity. So join us, follow along with us, because you're not alone. Christopher and I have, I've been battling the disease of obesity my whole life, like as far back as I can remember, maybe age 6. Christopher, maybe not so far back as that.
Only
but
30 years.
His whole adult life. So, we've got a lot of opinions to give you. So, and we want to hear from everybody else.
Oh, Wonky Donkey, you're correct. That is the video title. Eli Lilly's CEO, we can lower the price of GLP-1. Thank you, Wonky Donkey.
Thanks, Wonky Donkey. If you'd like to come on the Downsized Dish and talk with me about your GLP-1 weight loss journey, send me an email. And we'll send you a link to our calendar, and we'll get you set up with a time, and we'll have about a 30-minute conversation about you. And anybody can do this. If you're just starting, if you're curious, if you haven't started yet, if you've lost a bunch of weight, if you're in the middle of your, like anybody, because like everybody has something different. I've noticed that we've done over 30 of these interviews, and I always learn something different from each person. So come on and tell your story, and you might help someone else.
If you hang around on Friday, you'll see Barb from Health at Any Cost and Daughters interview. So super exciting there.
Megan's her name, right?
Yep, Megan. So and then join us tomorrow for Downsized Live.
We're so busy
7 o'clock Eastern Standard Time.
We're very busy.
And you can check out our website, thedownsized.org, for all kinds of fun stuff. Learn more about the cruise, Amazon store, you name it.
We're doing all kinds of things, y'all.
Let's see here. Always great info. Oh, one more question, and then we're out of here. Hi, I ordered 3 months supply on 1/4, received it on 1/14, even after 2-day weather delay. Bud date 7 nights. Oh, they were moving pretty good then. That's good.
Yeah.
So that is us for today. We will see you tomorrow.
All right. Y'all drink some water.
Of good videos.
I forgot to drink water until like 4 o'clock today. I'm trying to catch up.
Yeah. So I'm Christopher Durham.
I'm Laraine Durham.
We are the Downsized. We'll see you next time.
Bye.